Hi, my name is Dr. Jeremy Heidt and I'm a chiropractor and owner at Midwest Chiropractic and Wellness in Eden Prairie, Minnesota. Today I wanted to go over what is FAKTR. FAKTR stands for the Functional and Kinetic Treatment with Rehab. To simplify it, it is one of the best therapies that I've used on patients in 10 years to achieve rapid results. We can actually use some therapy to create an inflammatory reaction to promote healing, to actually get long-term results, which is very important in chronic issues. And we can also do this in a personalized manner. I'm gonna go over some of the treatment today just to kind of introduce it. So I have a patient here. I want to say that this patient has neck pain, and especially when she's looking over to the left. She's having neck pain with that movement right there. So one of the first things that we can do with this, and we can actually put her in the position of pain right there. And then we'll get in here and we can actually start working through these tissues. And typically when patients are having pain with any range of motion, we can actually feel that soft tissue is basically restricting that movement, which can be a part of their pain. So what we're able to do is we're able to use these tools, and this is a stainless steel tool, to work through that tissue to start loosening that up and help improving their range of motion. So we start in the static manner, and then we're going to add motion in there. So since she's having a problem looking to the left, we're just going to have her look to the left and then look straight ahead right there. And I'm going to have her just nice and slowly keep doing that movement. I'm going to start working through that tissue that I'm feeling that we're having issues with. And typically, as we're able to work on this, we're actually seeing that tissue start loosening up. And it doesn't even take too long before I can usually go back and let patients know, how does that feel? And typically within a short period of time, we're actually starting to feel that range of motion improve and their pain is starting to go down. From there, we can get into what's known as resistance. So there's many different things that we can use with this. We're gonna just use bands a lot of times for the neck, where we use basically resistance, where the patient is starting to fire those muscles and getting those muscles moving. So we're just going to go with one certain motion. We'll say the patient's having an issue with this motion. We're going to have the head nice and still, and then just using that arm. And we're going to start using this, and we're going to basically work through this tissue. And one of the nice things about this type of therapy is that when we go from that static to the motion to resistance, we're actually able to break through these plateaus, and we're able to continue to get improvement, which is very nice from a patient standpoint, and then from a treatment standpoint right there. And if we have a little bit tougher kind of tissue in there that just isn't quite responding like we want it to, we can get in there a little bit deeper. Typically we're going to treat at a pretty comfortable place. Our goal is always to decrease their pain and just increase their function while we're working on this. All right, you can go and relax right there. So that's the resistance. We can do many different things with that. And from there, we can actually get into different functions. So if I have a patient that is having an issue that working at a desk, we can actually put them in that position of pain, where we kind of just put them into like typing at a keyboard into that position, and we'll treat through that. And then we can get to a couple different areas as far as the treatment goes too. One thing that we do, this is just kind of one of the most common types of treatments that we use, those stainless steel tools, but we can actually use some cups where we go in there to kind of decompress that tissue. And what that does, that cup just lifts up that skin, so we're able to kind of suck out edema from under that tissue, and then we can slide these cups around the area that a patient is having pain, just to help with some pain relief. We can go kind of throughout the spine, but we can also work on any other issues: shoulders, elbows, backs, knees, ankles, a whole lot of different areas. We also use bands such as flossing, where we can kind of wrap them around a joint to kind of help get that movement, get that motion in there. And we also use something called dynamic tape if we need to, which is a tape that we can kind of put across different areas to help kind of lift up that tissue and really support that area. And one of the best things about this too is that we can combine this with a rehab program. So we're focusing on the soft tissues, but when we add it to rehab, not only are we able to get improvement in the clinic, but then we have patients on exercises that they can do at home to continue to build up the function and build up the strength of those tissues. When we do this, that's when we really see some very good improvement, not only in the short term, but we're able to see that long term too. So this is just a little bit about FAKTR. If you have any questions, go ahead and look around our website. Otherwise, reach out to us at the clinic. If you're interested in this type of treatment, you can always go ahead and either email us or send us a message, give us a call, and we'd be happy to schedule an appointment. The next step would be to get an exam to really see what is going on, what kind of dysfunction there is or discrepancies that patients are having, and we can take it from there, get you feeling better. Sounds good. Have a good rest of your day. Nice to meet you.